Okay, y'all, let's pick up with part 2 of chapter 5. Another thing that I want you all to remember, not only do you have to code the location of the burn, such as you have a third-degree burn of the abdomen, but you need to tell the total body surface area listed that the doctor codes, and that's going to be that code from that 948, and if it's unspecified, is 00. But also another important factor of burns that I want you all to remember, please remember the highest level of burn takes precedence over the other burns, such as if you have a third-degree burn of the heel, a third-degree burn of the heel, a second-degree burn of the leg, and a first-degree burn of the abdomen. The third-degree burn would be coded first, the second-degree burn second, and the first-degree would be coded third. Now, another thing I want you to remember also, when you have a burn, if you have a second-degree burn and a third-degree burn in the palm of your hand, you would only code that third-degree burn because it will trump that second-degree burn because they are in the exact same area. So make sure you would only code for that third-degree burn. The second-degree burn would not be coded. Okay? Just remember the rules and how you go about doing things like that. Remember your rule of nines, and you remember your rule of nines as it pertains to burns, that every part of the body is either equal to, or can be divided by, or can be multiplied by 9 to equal 9, or added up and divided and equal 9. This is the rule of nines. Every part of the human body is worth 9% in its own respect, except in the growing area. You remember that was that 1%. Or that 2%, I'm sorry. Now, the babies, the babies are ill proportioned, and until they grow to adult, where every part will be 9. This is the percentage of total body surface area that you will be working with when it comes to the babies. Okay? All right, now, you all, next going on into the coding, let's talk about some different other things that we can do in the integumentary system. In the general section, you would have a fine needle aspiration or an FNA. This is when you stick a needle into a cyst or a mass and you aspirate out or draw out fluid and cells. You can have an IND. An IND is when you can go in and you can stick a tube in and drain a cyst or a lymphocele or a seroma or a hematoma or an abscess. Or with a regular IND, all you have to do sometime is you can cut the wound open and allow it to have normal drainage on its own. Let's see, another type of drainage you would see a debridement. Remember, when you debride something, if you have necrotic tissue or old dying tissue, such as when you get that pressure ulcers in a patient, that old necrotic tissue, they go in and they they cut it off, or what they do is called debriding it, and that is cutting away all the dead stuff so the wound can start to begin to heal with the fresh granulation tissue, and everything starts to heal. The next thing that we have is the paring or cutting, and that is just like when you remove a hyperkeratotic lesion or a corn or a callus from the foot. That's that hard, crusty type of stuff, and it's usually not painful. You just pare it or cut it off. A biopsy is when you go in and you can have like a punch biopsy or any other type of biopsies, a shade biopsy. You're going in and you're going to remove either portion of or all of the growth, and you're going to send it off to the pathology lab to diagnose. Removal of skin tags or moles. Skin tags are defined as growth of both the epidermis and dermal fibrovascular tissue, and the skin tags removed are done by scissoring or any sharp method. The code selection is determined based on how many skin tags are removed, and y'all will see that when you look it up for removal of skin tags. The payer may consider this to be a cosmetic, so please make sure you check the details when doing skin tags. Shaving the epidermal or dermal lesions. Shave remove is often confused with a biopsy, but a shave removal is a removal of a lesion without taking a full thickness excision and does not require suture closure. The shave removal are coded by the body area and the lesion size. The physician will determine the medical necessity of shave removal of a lesion versus an excision removal of a lesion. Removal of a lesion by excision. Excision is defined as a full thickness removal of a lesion of the skin. Pathology will determine the code set as benign or malignant used for the proper coding. So that will be an excision of a lesion. All excised lesions are included with simple repair. In the case where the removal of the lesion is called for intermediate or complex closure, the closure is reported separately. Okay, so remember that simple. The closure is recorded or already included in the code, but when you get a complex or intermediate closure, you have to code the closure secondary. Remember that, y'all. Simple, closures included. Complex or intermediate, you have to code the closure secondary. Okay, it's a secondary procedure. Here we go with the nails, the fingernails. The nails are plates of tightly packed, hard, keratinized epidermal cells. The nail unit consists of the nail plate, the nail bed, the nail matrix, the hypounguium, the nail faux, the epiunguium, or the free edge. These are the parts of a nail. Report code 11719 for trimming of the non-dystrophic nails, any number. A non-dystrophic nail is essentially a normal nail that is unaffected by normal development or changes in structure or appearance due to a disease, injury, or aging. An avulsion of the nail plate is described with code 11730 for partial and complete and single. This procedure involves removing of part or the entire fingernail or toenail. After local anesthetic is administered, the physician separates the nail plate from the nail bed to remove the nail. If the physician is removing more than one nail from the fingers or toes, you must use the add-on code you all of 11732 for each additional nail. Okay, an avulsion of the nail plate is described. Okay, when a patient presents for a hematoma, a collection of blood of the fingernail or toenail, the physician removes the collection of blood using an electrocautery unit into the pierce the nail plate and drain the fluid. We'll code 11740. When more than one nail is removed, report each additional procedure with appropriate modifier of FA through F9 to indicate which fingernail, or a modifier TA or T9 to indicate which toenail. A polondial cyst is a sac under the skin at the base of the spine that can become infected. Code selection is based on whether the excision of the cyst is simple, extensive, or complicated. A simple excision of a polondial cyst will be 11770, is closed in only one layer. If several layers of closure are required, the documentation indicates an extensive or complicated code selection is directed to 11771 or 11772. The extensive or superficial underlying fascia greater than 2 centimeters of the cyst has multiple sinuses. A complicated polondial cyst may be infected with multiple sinuses. All right. injection is the filling of materials such as collagen is used to facets of reconstruction and cosmetic surgery. So when you are injecting an agent into something, a code from 11900 describes an injection of up to and including of 7 lesions. We would code an injection code of 11901 to describe more than 7 lesions being injected. Okay, so sometimes doctors choose to inject lesions, so it appears up to 7 will go all the way up to 11900, and then after you reach 7 or more lesions, you go to 11907. Introduction, you can have tissue expanders if you're trying to make the skin stretch. So you want to fix some kind of facial defect or some kind of defect, you will use tissue expanders. Okay, and this is like such as when you do breast reconstruction, maybe the patient has had cancer, you would use that 11960. The tissue expander is removed and placed with permanent prosthesis for breast reconstruction. We're going to report 11970. Certain circumstances, considerable capsular adjustments are necessary to allow proper placement of prosthesis within a fibrous capsule has formed around the expander, and the appropriate documentation code would be 19341, delayed insertion of breast prosthesis following mastopexy, mastectomy, or in reconstruction, and sometimes use 11970 instead. Repair and closure. Okay, you all, there are 3 types of repair and closures you want to have. The repair of wounds is divided into simple, intermediate, and complex. Now, this is going to be found in your ICD-9 manual. When it comes to a simple repair, this is a superficial and requires simple 1-level layer closure. This is also includes the use of Dermabond to close the wound. Now, intermediate repair includes the repair as described in a simple repair, but also requires a layered closure of 1 or more deeper structures, such as deeper level of the dermis. It also includes single layered closure of heavily contaminated wounds that require extensive cleaning and removal of particular matter. A complex repair includes the repair as described in an intermediate repair, but also includes wounds that require more than 1 layered repair, such as a scar revision, debridement, or extensive undermining. Necessary preparation include creation of a defect for the repairs or debridement of the complicated laceration or avulsion. Okay. If repairs include deeper structures such as nerves, blood vessels, tendons, refer to the appropriate anatomic system section for correct coding. The repair of these associated wounds is included in the primary procedure unless it qualifies for a complex repair, in which you will add modifier 59. Okay. And here are some examples, you all. You can go back and look over these of what I just read off to you. Simple, the complex. So make sure you go back and you read over that. Okay.